Hi, this is Patty Reger with Tri-Lakes County Health Department, and we are going to be looking at navigating the truth about vaccines in our social media world. So we're going to be looking at misinformation and how it leads to different fictional things that go out there, and we're going to be looking at how to determine facts and fiction. There are a lot of different social media sites out there and a lot of things being posted. So it can be very overwhelming, especially when we're hearing different stories about COVID-19 vaccine and whether or not these things are true or not is very important. So Tri-Lakes County Health Department is rolling out this program to help people know what the facts are and help them know how to determine what is fact and what is fiction. All of this misinformation that goes out on the internet leads to some different things that happen. One of them is vaccine hesitancy. So we're wanting to really see that people are getting their vaccines, they're getting the COVID-19 boosters as they come along. However, vaccine hesitancy is, according to the World Health Organization, one of the top 10 global health threats right now. Because of misinformation, people are starting to not get vaccinated and not have their children vaccinated at higher rates. There's so much information that goes out on social media, and a lot of adults, especially younger adults, are getting their health information this way and getting all kinds of things this way as far as their news and what's going on currently in the world. So we need to figure out how to slow down that misinformation. Public health we need to rebuild the confidence in the community so that they know that they can come to us for the factual information. So the problems with myths are that the problem with social media and myths is that social media continues to spread them. So one of the big ones is vaccines cause autism. This has been debunked many times in studies between populations that have been vaccinated and populations that have not been vaccinated have been found to have the same rates of autism. However, because things are shared and forwarded so much on the different platforms, this myth is still out there, and it does cause people to hesitate when getting their children vaccinated. Another one is natural immunity is better than vaccines. Again, this is something that is shared pretty widely. And the thing about natural immunity is in order to build antibodies against something, you do have to contract that illness or that disease. So as far as, say, the common cold goes, that's not too big of a deal. But when you get into more serious illnesses that can have lifelong consequences and even death, we don't want to have to wait and contract that illness to build immunity. So how do we know if things are true or not? We need to ask questions. First of all, is it coming from social media? Or something that someone is telling you? Where did they get that? Or are you seeing it on social media? Is the source cited? Is the source reliable if it is cited? And is it being updated, or is this old information? So we want to make sure that we are asking questions, that we're verifying that information is true before we share it. So disinformation is different than misinformation. Disinformation is when somebody takes a fact and changes it into something else. An example of this is when a manufacturer mentioned developing a microchip that could hold information about the different vaccines that people have had. So just a different type of electronic health record, a document. Someone took that information and shared it, but they changed it to not a microchip that's a document, but they said that microchips were being put into the COVID vaccine. So this was completely untrue, and it wasn't something where they misunderstood what was said in an original source. They literally changed what was said. So this is disinformation. obviously very damaging. Misinformation is when people share things that they think is true. So when somebody sees that post that microchips are being put into COVID-19 vaccines, they think, wow, this is something people need to know, and they share it because they believe it. So it's very important to confirm what is out there, confirm before we share. So all of this misinformation does lead to a lot of fear around vaccines, and we need to make sure that we have the facts. And some of the facts that have been just have not been shared nearly as widely are the fact that the COVID-19 vaccine has reduced emergency department visits, hospital admissions, and severity of illness. All of these things have been reduced due to the COVID-19 vaccine. So these facts need to counter the misinformation that's out there. So what we want to do with our campaign is we want to partner with you to put a halt to the misinformation that's out there. The health model belief tells us that people are more likely to get vaccinated when they have correct information. When people know their personal risk and they believe in the benefits of vaccination and they trust the information source, that they are more likely to get vaccinated. As far as our program that we are starting now and that we are wanting to disseminate out to everyone, we are incorporating data-driven communication to reduce fear around immunizations. So this communication combines transparent reporting, storytelling, trusted local voices in the community to reduce misinformation and fear around vaccines. So Tri-Lakes County Facts Over Fear campaign is wanting to replace fiction with facts in several different ways. One of them is short videos through different social media platforms, pop-up events around the community, QR codes linking directly to sources. So that will be on social media, be on websites. And what we hope to see in the next 6 months is an increase in COVID-19 vaccinations and improved confidence in public health and medical sources. Thank you for joining us today. We invite you to connect with us through social media platforms, our website, our local on-site location, and at local events. You can find us out in the community by keeping an eye on our social media pages. We will post when we are going to be out and about.